Okay. So we're here at Glens Falls Hospital at the Center for Excellence on Alzheimer's. I am with Heather O'Connor, the director of that group at the hospital, and Gwen Rowland, who's a social worker. Gwen also runs a monthly support group that Bella and I attend. And we're here to talk about, specifically, I thought our subject, at least to start off, could be the idea of when you start thinking about some extra help for caring, when you're a caregiver, for caring for the person you're caring for. How do you go about that? What is there available? It's something that came up, I think, at our last support group meeting. And I thought to myself, well, I really don't know what there is, how to access it, when I should start. I think Bella and I are kind of pretty far from that, but not as far as we used to be. So, that's kind of where I am. So, do you have any thoughts on that, Gwen?
Yeah, so, I think for everyone, a care plan is not black and white. I think specifically for you and Bella's circumstance, you're in a very unique circumstance. You're both so young, and, like you said, I do think you are somewhat farther away from that, from, the traditional, for an older couple, we might talk about, in-home care, day programs, that sort of thing. But when we're talking about younger onset Alzheimer's disease, it's so not black and white. And what works for one family is not going to work for all families. So really, I think our role in this situation is to help you guys navigate that and figure out what's going to work for you guys as a couple and a family who, with a young daughter living at home who's kind of similar in age as me. So
Right.
Kind of a unique circumstance there. But, it's so not black and white.
Right.
What I typically do when we sit down for a care plan is really I like to see where the care partner is at, where the caregiver's at. How are you feeling? How have you been coping? Because I really truly feel that you guys are the expert in your situation. You know what you need. We are just the links to those resources in the community and maybe to help you put the pieces together and see what's out there.
Right. I guess, for younger onset Alzheimer's, the big dilemma that's looming for me now, and it's not to a crisis point, but is the fact that I have to leave and go away all day. Yeah. And I come home for lunch each day, and I'm very close by. So if there is some emergency, I can just pop home. But,
Right.
That is getting harder. And, it's
Being away from Bella, or Bella being alone.
Yeah, well, both. Because it's getting harder for her, it's getting harder for me to, emotionally. She feels anxiety. She's, taking a prescription for that, which helps. But it's hard to be alone. She has our pets, which is good, really good.
Yeah.
One of the sort of the horrors of the disease is that it makes you less and less able to do anything. Because you not physically, but just mentally. And so, there's just sort of, less and less she can do to keep herself busy during the day. Gotcha. And so, I just wonder if we'll get to the point where, because since I'm only 58, and since we can't afford for me to quit my job, will we get to the point in 2 years where it's like it's just not working for me to be gone all day long, while if I were home or during the times that I am home, now it's pretty much fine. You see what I'm saying?
Yeah. So, what you're doing right now seems to be working for right now, but right, to your point, there's going to come a time where it's not going to work, and it is going to interfere with your ability to work. What are we going to do? From listening to the podcast and just knowing Bella, obviously staying home is the number one goal and priority. Am I correct?
Yes.
Yeah, absolutely. Of course, with Pepper and Beans and the animals. So, there will be ways to do that. I mean, right now you have Zoe at
Yeah.
home, but I know that she plans to go back to school, and
Yeah.
she has a life and things like that
Yeah.
goals and dreams to pursue. So there might come a point where we start thinking about hired help and those sorts of things, or bringing in maybe more spread out family members. How can we engage them in sort of a constant schedule of care and supervision that Bella's okay with, that you're okay with, and that the people providing it are okay with.
Yeah.
So it's totally not black and white.
Right.
My question for now is just reviewing, I guess, safety at home. So Bella's driving.
Yes.
Okay, and you drive. Have you driven with her recently?
Yes.
Okay, and seemed fine.
Yes-ish. I mean, I think, I'm not the greatest driver myself, but unfortunately. But
I have a tendency,
as my kids will tell you.
spouses to criticize each other's driving,
Yeah.
even when it might be okay to other people.
Yeah.
So it's like a really tough question.
Yeah, no, I'm tempted to lie about it, but if my kids heard the podcast, they'd be like, "What?" No, I that's a concern. That's also a looming concern. It's not like I'm thinking, "Whoa," she's got to stop doing this, now. But
Right.
but I was observing her driving the other day and thinking, yeah, I notice something. I notice differences that are not, that great. Well, for one thing, she's going a lot slower. That's good. But there's other things of,
She's probably more aware and maybe a little less confident, which we
Right.
know happens with time. But I do want to make a point that a diagnosis of Alzheimer's disease instantly does not mean that someone needs to stop driving. It really,
Right.
and driving, again, is not black and white. There's a lot of gray area.
Yeah.
And we really do hold a lot of that responsibility on the family to keep an eye on Bella and keep an eye on that. And, really you guys are going to be the ones to identify when there's the concern. So that's just
Right.
the reason I ask. She's driving, she's going to the Y during the day.
She still is doing that some. We actually started going together now after my work, so that's
Okay.
good.
And that's great. And that's something you guys do together and family activity. Now, when you're at work, she is managing her medications and meals throughout the day.
Not yes and no. I mean, she eats when she's hungry. I mean, I mean, sometimes I'm concerned that she actually doesn't. That she'll sit there all day and not eat very much, and that's a concern. And it's so weird. I don't know why that's happening. But the pills I keep track of. I mean, most of her pills she takes in the evening before bed, so I keep track of all that. The anxiety pill now, the new one, is 4 times a day, but we do that breakfast, lunch, dinner, and bed. So I'm there for those 4, so I give that to her.
You go home for lunch?
Yeah.
Oh, great. That's excellent.
Yeah. So, and that makes a difference. I mean, that's a huge deal, I think. The fact that I'm in town and that I do see her during the day, it's reassuring. Mm-hmm. I mean, a big part of the problem for us, I think, is kind of an emotional fragility that is, and vulnerability, and dependence on me that has developed, and is hard. It's hard to see, and I think it's hard for her.
It's a big change. We do, I see a lot that people, as the Alzheimer's progresses, either it's that anxiety that's going to creep up and hit you when you don't expect it, and
Yeah.
all of a sudden you're living with anxiety, and that's really challenging, or depression as well.
Yeah.
There's these little looming factors that are going to start coming in and sort of now being a part of this, and then
Yeah.
learning to cope with that. And especially that anxiety, we find that as people move forward in the disease, they don't want to be away from their care person. I mean, you are her rock,
Yeah.
that when you're gone, her, she's lost,
Yeah.
most likely. And, getting back to the eating too, we see that a lot, that it's, it's a few things, maybe she's so distracted throughout the day, or just, her body's not telling her, Bella, it's lunchtime, I'm hungry, I have to eat. That's not a conscious thing, more of an unconscious thing.
Right. Did you have any thoughts on any of this, Heather?
I think what's interesting is the impact it makes to the caregiver. For you at 58 to have to consider what will 2 years look like for me. And I think it's a huge testament to your commitment to her. I think it sounds like you are doing everything you possibly can. But I think most people at 58 are forecasting, what will my retirement look like? Will it be South Carolina, Arizona, or Florida in the winter months? And I think that's the voice to your podcast that I really appreciate, because I think there's a whole group of people that are facing a different life than other people recognize. And I think that's really where part of the care focus needs to be on, is the caregiver themselves, right?
Absolutely.
Well, I appreciate that. I mean,
without seeming maudlin, I just think it's something that has to also be part of the dialogue with dementia diagnosis, because it's unlike some diseases, and I think it's more protracted. And I think an extension of that is you really need thoughtful planning to help support you as well.
yeah, that's a good point. I think that's true. It's nice, we have Zoe living at home. That's really nice for me as well as for Bella, and she and I can talk and hang out and whatever, and it's, that's nice. I've become more vulnerable and emotional myself through this experience, and I talk about it and I get choked up, and it's like, I didn't used to be such a crybaby. But it's not, I do think it's like making me a better person. I mean, there's that aspect of the disease where it's like, well, you don't really have any choice. You're going to deal with this, and it makes you more, I think, understanding of stuff people are going through, so that's, hard experiences are hard. I don't want to downplay that, but they're also good in some ways.
Quiet, yes. Right? That you didn't ask for.
Yeah. I'm not saying I wanted this to happen, and I'd love for it to go away, but you know what I'm saying.
There's some but
You've grown through it.
Yeah, you grow as a person.
You learn, and it's something I appreciated that Zoe had said, was she said, this didn't come with a rule book, this doesn't come with a guidebook, and it doesn't. I have families come in all the time, they think they need to know everything, and they think, I'm not doing this right, I'm not saying the right things, I'm not looking for the right things, and that's okay. You're going to make mistakes, you're not perfect, and this isn't perfect, this is hard, I tell people all the time, it's the hardest thing you'll do in your life. I've never been through it, but just what I've learned and what I see from the families is it's excruciating, and we like to identify that as a care partner, as a spouse of someone with Alzheimer's, you are a second patient as well. I say that all the time. If something happens to you, Will, where's Bella going to be with that?
Exactly.
So we really have to focus on making sure that care partners are okay. And
and I do think it's important to be selfish sometimes. I mean, in just in a way that I would have been selfish before Bella's diagnosis without thinking about it. Like, I'm going to go to the Y and work out, and Bella's like, oh, you're going to be gone. And it's like, because I have to keep myself healthy, or else this whole thing falls apart. So,
It's like they say in the airlines, the oxygen masks have to be applied to parents first, right? So that is, I think what's interesting to, what I appreciate in Gwen's work here at the center is the ability to point families into programs in the community that have mechanisms to support the caregiver. And, Gwen had indicated it's not black and white, and I think the idea is to have it be an iterative assessment, to look at where the person is with Alzheimer's or the other types of dementia that exist, and assessing in the current state that they're in, what's the best resource to help not only the patient but the family as well.
So, and, Will, there's so much that we could get into, in terms of future planning. And, I like to talk about all the legal stuff and the financial stuff. And, I don't know if, now is the time we can, but, we'll keep working together to come up with that plan. But right off the bat, you are engaged, with the support group, you and Bella. So Lindsay Stanislawski, the program manager for the Alzheimer's Association for Warren, Washington, and Hamilton County. So you're engaged with her. You know what she has to offer. They're wonderful. I don't know if you've met with the Caregiver Support Initiative yet. Have you met with them?
yeah.
You did? Okay.
I went up there, but I went up there maybe a year ago or even more. And at that time, it was kind of like, okay, I mean, I see you have stuff to offer, but it's not stuff that I'm really ready to take advantage of.
Yeah. Okay.
I mean, it's things like respite or like that. It's like, okay, well, I didn't really need that at the time, and I'd say we still don't really need it, not yet.
And I would agree with that. However, I do encourage families. It's like something you keep in your back pocket, right? You get enrolled, and you're right. We don't know. This disease can be so unpredictable. So I say, get the care consultation done, apply for the respite, let them know what your intentions are. Like, I don't think I'm going to need it right now, but, you want to be familiar to them because, tomorrow, you don't know could be changing.
Yeah.
So I think it's always good just to keep those things kind of tucked away, keep it in your toolbox, you never know what you might need.
Yeah, that's good advice. I mean, it is, there's so many strange things about it. But the planning part, the planning for the future part, is probably sort of where I feel most, incompetent, I have no idea, what do I do and when do I do it? You know what I mean? Because like you say, you don't know how fast things are going to progress. You really have no idea where you're going to be a year from now.
Right.
And, or how long it takes. Like someone was talking about, some Medicaid, getting on a waiting list for people, home care for Medicaid or something. I can't remember who that was. It someone at the support group, I think. I can't remember.
Probably.
And said, they signed up pretty far ahead of time, and then that worked out because by the time they needed it, they were able to get some of that sort of help. So, I don't know.
Do you want me to talk about Medicaid?
Sure.
Okay. So, I'm not an expert in Medicaid, but really my brief spiel and overview of it is that there's different types. People think Medicaid, they think that's what people go on to get into a nursing home, and that is one avenue. However, the other avenue is called community Medicaid, and that is where Medicaid provides the same level of care a nursing home would, but in the home. And the challenge with that, of course, is there's a national shortage of home health aides. So these Medicaid waiver programs, while the intentions are excellent and they can provide good care, if we don't have the staff in Glens Falls or Hudson Falls or Queensbury to cover the amount of hours families need, it's not going to be helpful. So I probably what that person was talking about in terms of a waiting list was, well, and it can take quite some time to even get on Medicaid. Because I'm not even going to get into the different avenues to do that, such as trusts and spend downs and these things called spousal refusals. And, typically I work with other people in the community for help with that, like SAIL or elder law attorneys. But basically it is something you want to do somewhat ahead of time before you need it.
Well, we did talk to our lawyer about that. We went to a lawyer who got recommended by folks in the group, and we did their, will and all that stuff. And
Power of attorney?
Yeah, power of attorney and the healthcare proxy and all that. And he did address Bella's on Social Security disability.
Yep.
That's what she got on after leaving work. So he did talk about qualifying for Medicaid and looking at our finances and stuff like that and trying to, make sure that could happen.
And there's different, you get on Medicaid, there are different waiver programs that people get on to provide the care. One of them, for example, NHTD, it's called Nursing Home Transition Diversion. It's basically where you contract with a home health agency in the area and they'll provide all the care. Another Medicaid program that families are kind of leaning towards now because of the home health aid crisis is called consumer directed. So it's where you and Bella would identify someone who Medicaid would pay to provide care. So it can be a family member, it can't be a spouse. So it could be a child, a cousin, a sister, whatnot. So I think that tends to be a little more desirable if you have someone identified. I know our people up north tend to utilize that more if they have someone who's able and willing to do that.
Right.
But again, they're accepting a Medicaid rate, which, for some people works, for other people it doesn't.
That's
So
interesting.
there's options, yeah.
That's interesting.
Yeah.
So if someone was trying to find out about that, their options, would they come to you? Was that where they would start? Would they come here?
They could. Typically, yes, if families are patients here, if we see them here, I'll meet with them. But people can definitely call me. They can call the Alzheimer's Association. They can call the Caregiver Support Initiative, the Southern Adirondack Independent Living Center, SAIL in Queensbury. They help many, many people with Medicaid applications and getting them on the waiver program. Elder law attorneys. I hope I'm not leaving anyone out.
And at the SAIL program, I think the navigators are a
Oh,
free.
yeah.
A lot of these organizations have free services too.
And it's
Offer.
all of these would be free, but,
Right.
besides coming to us, which is a medical office, but
And the elder law attorneys. But I think there are resources in the community designed to help navigate a family.
That system.
Right.
Yeah.
And I think what's interesting about the policy behind these programs is they're really very well intended, and I think best executed when done with sufficient planning, right? Sufficient
Right.
time. So that is the advantage of having a diagnosis early in the process. It isn't that it could change the landscape for you, but it, I think, can enable you the opportunity to really research and set into place framework to make it more doable
Right.
when the time
Yeah.
comes that you need to execute on it.
Right.
So time is to your advantage the earlier you can get a diagnosis.
That's interesting because it's easy when I think this is my fear that I just kind of get into a pattern. It's like, okay, this is where our life is now, and we're just going to deal with it and handle it, and not do the things that need to be done to make it, things easier or better or, get better care and that sort of thing. I mean, I think that I could see how that could easily happen to people.
And that could be really discouraging, right?
Yeah. Yeah. Well, if all the burden's on you,
Right.
And that burden gets heavier and heavier over time and you get older and older, while you're trying to carry it, then yeah, I think that must be
Exhausting.
really rough on people.
And I think the idea behind trying to implement a plan is so that you can not only avert a crisis, but you can spend the time in a quality state for that
Yeah.
for that phase that the person is in,
Yeah.
right? That you're doing you're making the best that you can out of, you're making the lemonade, right?
Yeah.
So
Yeah.
And I think, right, and the goal, of course, is for Bella to have the highest quality of life possible, and really, to put her in the driver's seat, figuratively put her in control. Knowing what she knows, knowing what she doesn't want to think about, but what will she want that to look like?
Yeah.
Have you guys had those conversations?
No, not really.
No. Okay.
No, I mean, not beyond the, Bella saying, she wants to stay home, and
Right.
me saying, yeah, that's what I want too. I mean,
Absolutely.
not really. Nothing practical like, well, what exactly are we going to do when, it becomes difficult for you to, handle everyday life, at home by yourself if I'm still working, like what are we going to do? We haven't really faced that, so that's kind of why I'm here. At least start the process.
Absolutely, and then I think as you learn more, and as we keep working together, we'll loop Bella in, and definitely make her a part of this. Absolutely.
Yeah. It's it's tricky, It's like you don't. I think there's a natural resistance to sort of like admitting if you're getting to that point, like, oh, you need help. Like for me admitting, well, for me observing, like her driving's getting worse, and then thinking to myself, at some point, I'm going to have to say something about that, It's like there's a natural reluctance, and at least it's natural for me.
And I think for both of you being younger, it is even more of a unique circumstance because, and you're not the first couple I've seen this with, kind of like that, well, when do I know? When do I know we're reaching the next level, or when do I know when I need help?
Yeah.
And, bottom line is, well, only you know that, only you guys do, but, we can definitely help guide you in that right direction and figure those things out.
Yeah.
But I do see that with younger couples, especially because I just think it's that much harder.
Yeah. I think she and I should come in and, and talk to you, and maybe go to some of those other places and, try to come up with some kind of rough plan, maybe not any kind of timeline, but yeah.
Figure out, give Bella, open her eyes to, what's out there. And, Bella, if you had, the choice between this, that, or the other, what sounds better to you? And just so we know what her wishes are when, she might not be able to express that.
Yeah. Yeah, that's a good idea. I mean, with every step like that, there's the, you sort of you go over this emotional bridge, kind of like, I'm admitting that things are getting worse, and I'm admitting that I've noticed that, and I'm telling you that, you know what I mean? It's like I'm honest with Bella, but those things are still difficult, and it's difficult, but it's even more difficult for her. It's like I think every time. I think a lot of the weird thing with Alzheimer's is if you're the person who's afflicted, you don't necessarily notice what's happening, and that's the bizarre thing. But if you do notice, if it's sort of shoved in your face, then that can be very painful.
Absolutely.
And
Absolutely.
That's why I, sort of hesitate to.
And and we see that sometimes the person living with the diagnosis doesn't have that insight, and we don't necessarily know why that is. I like to think it's that one part of the brain is not talking to that other part of the brain, so that awareness isn't plugged in. But, some people also see it as a protective factor that, you know, while you're suffering and seeing the changes day to day, it's almost a blessing that that person isn't seeing it, because it keeps them like just functional and you know, kind of bars them from the reality.
Yeah. So sometimes I do think it's good, and other times it's like,
Other times,
you know, it might be good if there was more awareness.
right. Might be, yeah.
So, okay. Well, that's all good. Is there anything else that we should bring up in this context?
Well, there's a lot I want to talk about, but
Okay, well,
I know we're kind of pressed.
We're not pressed for time.
Not
I mean,
pressed for time, but in the means of the. I mean,
and we can always do another one. But if there's, you know, I mean,
Well, there are, the one thing I'd like to say is there are, even, you know, just as we talked about resources in the community for planning on Medicaid and home care, there's also resources. I mean, driving's come up a lot, and I think you're a good barometer because you're the witness to functionality, but there are also driving resources to help assess someone that you could also utilize, which is valuable, because I think the common denominator, I think, with this disease in terms of the challenge with it is the difficulty in having the conversations.
Yeah.
Right?
Yeah.
And I think that in itself could probably be a podcast, right? Because
Absolutely.
it's, I think that if someone has framework to have conversations, it might make it easier. Because it's basically a series of very difficult conversations that I think occur over time, right?
Yeah.
Not all at once, thank
Right.
goodness.
Right.
Yeah.
Right.
Yeah.
I do just want to mention though, you know, particularly, you know, because you guys are kind of separated during the day, there are different maybe identifications that are helpful for both someone living with a diagnosis and their care partner. You know, God forbid the worst thing happens, you're in a car accident or something happens to Bella, you know, it would be most helpful and probably in benefit to know that they're living with a disease or that you're a caregiver, you know, that someone is at home and relying on you. So the Alzheimer's Association has a Medic Alert Safe Return Identification Bracelet, which can be found on their website, alz.org. Something that also that I'm finding more people are wearing, it's called a Road ID bracelet. It's actually people who are in marathons wear them because they're very athletic looking. They almost look like a Fitbit, and you can get all different colors, but you can personalize it to say whatever you want. So I have one couple who the spouse is the caregiver, and he has one that says his name and that he cares for someone, and then his wife wears one too, and they're kind of matching. You know, they're stylish looking, so people are more, I think, adept to wear it. You know, I encourage families to get one. You know, maybe like a gift, or you know, they're usually more inclined to
What are they
put
called?
it on. It's called Road ID.
Okay.
That's just, I know there's probably plenty of brands out there, but that's one that I've checked out that you can personalize it to say whatever you want, and different clasps, and it's just, I could see how it could be, you know, almost life-saving in some circumstances.
Okay. That's good advice.
Just,
okay. Yeah.
So much to think about.
Yeah.
So much to think about.
Well, thank you. I guess that's it for now.
For now.
We'll do more later.